Dr. Rich Castellano, the Smile Doctor. We're here today with Jill. Thank you, Jill, for letting us share your video today. We're doing our local anesthesia facelift. How is Jill feeling?
Wonderful.
Very good. Jill's had some of the relaxing medicine. Do you feel that Valium?
Love it.
Very good. It's good stuff. I feel pretty relaxed too, but I did not take any Valium. So this is where we're working with Jill today, the neck and the jawline there. And Jill is coming all the way. Where are you coming from, Jill?
New Jersey.
New Jersey. She works in hair, and we essentially do the same thing, right? You make people look good,
Yep.
and it makes them feel good.
That's right.
So today is Jill's turn. So Jill, how long have you been thinking about having something done for?
Oh, a few years now.
A few years?
Yeah. Yeah.
I'm just going to adjust this over here. What was holding you back? There's Yesenia. Hi, Yesenia.
You know, I don't know what was holding me back. I always wanted my eyelids done because
See
I
those
always,
gauze there, Yesenia? Can you scoot that over a
always
little bit?
thought they were droopy. You know, and
So we're going to trim that eyelid skin, and then we're going to do the lift. And your friend is coming to do the treatment too, huh?
yes, she is in March. I think the 16th.
Very good. You're the leader.
Yeah, of the pack.
Very good. So we're doing a local anesthesia facelift. My name is Dr. Rich Castellano. I'm a double board certified facial plastic and reconstructive surgeon. And Yesenia is here with us. She's got everything set up perfectly. Makes it very easy for me. We're in Tampa and the Villages, Florida. We are on a mission to stop bad plastic surgery. We're here to show you how to do things the right way. So we've already done a little bit of the lip plumper. How was that when we did the lip plumper?
Fine, didn't feel a thing.
Very good. And so now we're going to do some of the local anesthesia. I use a tumescent solution. Patients who watch the video, they say it's actually easier. Can you recycle these things? It's actually easier, I did that earlier, to have the procedure done than watch the video. I'm going to turn your chin all the way up so you see we got about 4 inches here, so we need to make sure we close that up. You feel a little pressure. Do you feel any pinching here?
No.
So I'm not in a hurry, just a little bit of numbing medicine here. Everything's looking good. Thank you for watching. Thank you for sharing. We know you have a family member or friend who is interested in having a treatment done. And you can help them save money and do it the right way the first time around by sharing this video. I've done over 4,000 facelifts under local anesthesia. Most surgeons retire after doing about 500 or 1,000 facelifts. Everything's looking good. Pressure pinch. So I'm going to go through our ABCs of plastic surgery. Now, how long have you been watching our videos for?
About a month.
About a month. So why now, Jill? What was it that inspired you to say, I'm going to do this?
Well, I saw my friend Deb have it done here about in November, and I couldn't get over the difference. That's it. I'm doing it.
Deb looked really good.
She does.
You didn't want to let her have all the fun.
No. Absolutely not.
So the tumescent solution, it numbs, it also reduces the blood flow to the area, which is favorable, obviously. Takes me a couple of hours to do the lift, sometimes a little less, sometimes a little bit more. And I like to go through what my ABCs of plastic surgery are. When you know the ABCs, you will make your best decisions when you understand the big picture. So A is for area. There's 4 main areas that we address to improve the facial appearance. If we sag, we tighten. If we lose volume, we fill. Sun damage, wrinkles, and sunspots, we can polish and repair the skin. The 4th area is better than everything else. That's our behavior. And Jill definitely knows the power of smile. None of our treatments look as good as a smile. Then there's the 4 rules. You feel big pinch, little pinch, not too bad there? The 4 rules for good plastic surgery. That's the boundaries. Safety is always first. You must look natural. Let's prevent future aging changes, and let's get as much improvement as possible. We can't make things perfect. We're not God. We do the best we can. If we need to come back another day and do more, that's better than going too far. Someone says she wants to get out under the eyes, so we can help that. A lot of times you can do fillers and you don't need any surgery. So fillers are a great way to try to avoid lower eyelid procedures. Thank you for watching. Thank you for sharing. We're in Tampa and the Villages, Florida. You can download our Wall Street Journal best-selling book. I was just reviewing, and the book is We Guarantee We Can Make You Look Younger. I was reviewing our ABCs of plastic surgery for A for area, tightening volume, skin behavior, B for boundaries, little pinches. You gotta be safe. You will look natural, prevent future aging, and let's get as much improvement as possible. Let me turn your head this way a little bit. C stands for combination. If we want our best results, we combine. Combining tightening volume and skin always gets the best results. Little pinch there. If you want your best results with just one treatment, then we talk about tightening. Best results, no downtime, filler. Filler does a great job, but it doesn't give us a lift. And lifting, I get wonderful results, but I can do even better when I combine. Little pressure pinch there. So if you know those three categories, combination, solo treatment, and then no downtime, whichever treatment you choose, if you're happy with your results, great. But if you want more than what you've achieved, you can either do more of the same or you take the next step. Very good. I'm going to turn your head just a little bit more that way. Is that okay for you like that? So tumescent solution for my physicians and students that are watching. This is subcutaneous. You can see that it increases the volume a little bit there. And that's good to help improve the dissection. We're going to be using the laser lipolysis to remove some of the fatty tissue. And it also creates a thermal injury under the skin that helps to tighten because we lose the elasticity in our skin. Everything's looking good. Thank you for watching and thank you for sharing. We have people watching and visiting from all over the country and even internationally. So we're proud to be leaders in live video for awake facelift patients. Everything's looking good. Hello, thank you Suzanne for watching. Hi Pat, let me turn your head this way now. And turn just a little bit more, good. Little pressure pinch. Do you feel big pinch, little pinch, not too bad?
Feel nothing.
Me neither. Everything's looking good. That's the one. I just need to take a picture of that.
Yep.
For me, that page, that one page is all I need.
Yep.
Thank you, great job.
You're welcome.
And then I do need that other chart too. Thank you, that's exactly what I need.
Yes.
We have such a great team. They're always helping me out so much. I feel very well taken care of.
You're wonderful.
We got a great team. And Yesenia has everything set up perfectly, makes it very easy.
Wonderful.
Everything's looking good. Perfect. Little pressure pinch there. Very good. So the tumescent solution for my physicians and students that are watching, it's made up of lactated ringers. Jill, how you feeling, dear?
I'm wonderful.
Everything's looking good. You feel a little pressure, a little pinch. I'm going to turn your chin to the middle and chin all the way up for me, please. That's good. Pressure pinch here. Pressure pinch, or not too bad?
Yeah.
Now, with the ABCs of plastic surgery, the C stands for combination. D stands for different perspective. We never see ourselves the same way that other people see us.
That's right.
Someone wanted to know price, excess fat on your chin. Go to imagelift.com/pricing and you can get the price, or call us 813-463-9245. It's actually misleading to give a price if you don't have a plan. because your plan, if you need more or want more, it's not a one-size-fits-all. So you need to have a consult. But you can go to our price estimator on our website and maybe figure something out, or call us and we can do a virtual or face-to-face consult, 813-463-9245. Everything's looking good. So we never see ourselves the same way that others do, because when we look at other people, let me turn your head this way now, we look at them socially. But when we look at ourselves in the mirror, we do not look socially. We look seriously. And we can be hard on ourselves, and it can make us feel bad. That is the reason why people go too far. They're too hard on themselves. They don't have the right doctor to protect them from going too far. Everything's looking good. Marker, please. I'm going to turn your head to the middle because we are going to be doing eyes as well. Thank you for watching. ¿Cuánto tiempo dura hacerlo? How long does it work for? The facelift duro 5 or 15 años. Lift your chin for me a little bit. There we go. Y alguna persona regresas 1 o 2 años después. Algunas personas esperar 20 años para de última lift. So tú tener muchos años después de tratamiento para resultados. Para mis pacientes, hablemos español. 813-463-9245. Muchas gracias para tu pregunta. I lived in Ecuador for 3.5 weeks, so I learned my Spanish there, and I still need to keep practicing. Thank you for watching. Thank you for sharing.
How long is the procedure?
De cirugía necesito 2 horas. How long is it, or how long does it last?
How long does it take to do?
Okay. I talked about how long it lasts. I answer both.
I'm pretty sure that was the next question.
Yesenia is my translator. Like, what is he talking about?
No,
That's
more
good.
than I do, Doc.
I get it. I enjoy it, but it takes a little extra brain effort for me to. You know, when you speak a different language, you feel like a different person. Like you change already. I say, hey, I'm Dr. Rich. Por favor, manténgase alejado de las puertas. You know. Okay. Okay, can you turn the laser on, please? Okay, so now your job, Jill, is keep your eyes closed. We're going to put these little eye shields on to protect her, and then I only activate the laser when it's in a safe place to do so. So you'll feel pressure. If you feel any pinching at all, you let me know. Everything's looking good. Are you feeling any discomfort at all? Perfect. So if you're just now joining, Jill's coming from New Jersey to have her treatment done. We have a lot of people that travel, and we do recommend getting the vaccine if you can get it. I've had both of my doses. There's no contraindication for the fillers or for lifting to have the vaccine done. We do recommend it. But your second dose, you expect that you'll have a little bit of the wind out of your sails. They've given 50 million doses so far in the United States and almost 150 worldwide. So some people are waiting to see what's going to happen. 50 million doses later, you're kind of seeing what you're going to get. So a few rare cases of thrombocytopenia, but still, in my opinion, it's definitely better to get the vaccine. Can you hit all these buttons so we can be ready to start?
I wish I could get an appointment.
Yeah, they'll have more availability soon. So this is the 1064 1320 laser. Now it's ready. You see that's the helium neon beam right there, that little red that's coming out. So this is laser lipolysis. We're going to break up the fat, and we're also going to create a heat injury under the skin. So you hear this little popping noise. Do you feel any pain at all there?
No.
So it's just And then we measure the temperature with the external monitor. I measure with the amount of energy I'm watching on the machine, how much the laser energy is being given, and I can feel with my fingers the temperature.
Take it a
Everything.
little low.
You feel a little pinch there?
No?
Okay, good. So Jill doesn't feel anything, which is normal. A lot of people say, boy, that looks painful, but they just can't feel anything.
No.
Thank you for watching. Thank you for sharing. So do you have any books or movies, Jill, you're going to get into while you're relaxing at home?
Well, I was reading your book,
Which book did you read?
the white cover
The
one.
Smile Prescription.
Yeah,
What, did you like that?
I love it.
You're so sweet. Thank you. See,
I
Jill's a
loved
good
it.
smiler. She knows the power of smile.
Yeah.
We all need a little more smiling in this
Yes,
world. My
we
wife
do.
and kids are like, Dad, enough with all the smile talk. But they're good smilers, so they got to put up with it.
Yeah.
But I cannot say anything funny around my kids. They're like, Dad, that's not funny. I'm
I
like,
know.
I know if I say something that's funny, because you guys will say, Dad, that's not funny. And they're like, Dad, that's not funny. I said, see? Everything's looking good. Thanks for watching, and thank you for sharing. I promise you got someone, a loved one, a close family member, a friend. They want to do something. Share this with them so they can see what's possible. I have people who have been watching our videos for years, and they say, it's nice to meet you. I feel like I know you. And the favorite thing they love to hear me say, they say, everything's looking good. So it's true. I say that a lot. Some patients will say, will you say that to everybody? And I say, look, I say it when it's true. And if it's not true, I'll make it look good, and then I'm going to say it. But the bottom line is it looks good every step of the way. And if we take a little half step off, we just get right back on. I know this path. I've been down this road many, many times. So I make it. Say again? Yeah, that's right. This is very much artistry. And I'm excited for Jill. Jill, how long have you been waiting to do this for?
Oh, many years. About 15 years.
See, this is so special that Jill has been wanting to do this for so long, and this is her day. Someone said, say the number again. 813-463-9245. That's 813-463-9245. Thank you for watching. Thank you for sharing. I can already see how some of the fat is breaking up, and we're getting a little more contouring. Hola, ¿cómo estás? Muchas gracias para to share. ¿Cómo se dice to share?
I told you to speak more better Spanish than I
So,
do.
what's that?
I said, I told you to speak better Spanish than I do. Share.
What do we say? Sobrevivir or para vivir?
That's the
I
word.
know.
Let's see, I know some of y'all Spanish people out there. What's the word for it? Share.
Yeah, what does it mean to share the video in Spanish? To send the video.
Mandar.
Muchas gracias para mandar the video to amigas y familia. And if you have a family member or friend that wants to learn more, you can download our Wall Street Journal best-selling book. We guarantee we can make you look younger. And the Smile Prescription. Everything's looking good. Me fascina las cirugías, pero mirar, no. That's it. I couldn't
Me fascinan
understand.
las cirugías, pero no me gusta verlas.
Hello Nelly, hi Ruth, muchas gracias para mirar the video. Everything's looking good. So I'm breaking up the fat. I'm also, hi Sandra, thanks for watching. I'm also heating up the undersurface of the skin so that it tightens. And we're going to tighten the muscle layers too.
Good.
Soy muy nervioso. Pero Lisa no está nervous. Jill no está nervous porque tomar the medicina para relajo, the Valium. Everything's looking good. Hi, Choli. Thank you for watching. Thank you for sharing. We're in Tampa and the Villages, Florida. We have our seminar in the Villages tomorrow at the Waterfront Inn. Please come by and visit. You want your face to hide in Colombia for 7 years? Yo quiero la cara. Okay. Llamar a la clínica mi oficina, hablemos español para ti. Okay. So, we're on a mission to stop bad plastic surgery. We're here to show people how to do things the right way. We want to do it safely under local anesthesia because people don't want general anesthesia. They don't want to go too far. They don't want too much. Salam alaikum. We see someone's coming there in Arabic making some comments. Everything's looking good. Thank you for watching. Thank you for sharing. This is a modified smash plication facelift. Perfect. This is the Cynosure triplex laser. Laser lipolysis. We have a fiber optic that delivers the laser energy. I'll be starting with the platysmoplasty. Hello Liz. Hello Dawn. We have facial fillers. We have laser resurfacing. This world needs uplifting. We're here to help people look their best and feel their best. So this is not traditional plastic surgery. People do not want overdone look. They want to look natural. Someone said, can this be done if you're a diabetic? Thank you for the question. And the answer is yes, Jessica. You can do it if you're a diabetic. Yo quiero hacer la cirugía de cara, pero necesito una evaluation. Por favor, llamar la clínica 813-463-9245. Hi, Don. Hi, Saskia. Thanks for watching. Necesito consultación y dar de plana para tu cara, ¿ok? So, llama a la clínica y nosotros ayudamos tú. Very good. And I'm getting to practice my Spanish too. I do need a little more practice on my Spanish.
Me too.
You know, the best way I learned how to speak Spanish was singing songs in Spanish.
Yeah.
Gloria Estefan.
Oh, I love her.
Me queda una oportunidad. No es tarde para recapacitar. Que nuestro amor es verdadero con los años que me quedan por vivir. Cuánto te quiero. So those songs were so good to help me learn pronunciation. I can't believe I remember those lyrics. But when you learn that stuff, you just don't forget it.
Oh.
That helped me the most. People tell me I do good pronouncing and pronunciation, and it's the music that does it.
You go to Colombia restaurant?
I've been there many times.
Me too, I love it.
What is that? What is true?
Gloria Estefan, J-Lo, and also, what was his name? Daddy something? Some other rapper he's got a really good name. Daddy Yankee. Ha ha ha. But his lyrics aren't as appropriate, I guess. Everything's looking good, thank you. You're welcome, thanks for calling. Hello Superwan, hello Nina. Thank you for watching, thank you for sharing. We're in Tampa and the Villages, Florida. I am a double board certified facial plastic and reconstructive surgeon. We're doing laser lipolysis. I'm going to turn your chin up just a little bit. So now I'm going to be doing what's called the platysmoplasty. Perfect. Everything's looking good. So just elevating the skin. How are you feeling, Jill?
Good. I don't feel a thing.
Everything's looking good. Thank goodness for lidocaine.
Ooh, unbelievable.
Now she was saying oof because it's unbelievable. She didn't feel anything there.
Nothing.
Yeah, even some other surgeons will say, really, how can you do that? Is that possible? But I've done it 4,000 times. So the answer is yes, it's possible. Everything's looking good. Closure, please. Perfect. Thank you for watching. Thank you for sharing. We're in Tampa and the Villages, Florida. So just trimming a little bit of the fatty tissue here. I'll use the laser lipolysis to trim. You feel a little bit of a pinch there?
No.
I'm going to add a little bit of numbing medicine because just for good measure. Because I'll go right on top of the platysma muscle. The platysma, if you ever watch The Incredible Hulk, and he's got those little bands that come out from his neck when he flexes, and that's the muscle that we're going to tighten here.
Oh, good.
And we're going to go right to that layer. And when we're flexing or expressing ourselves vigorously, sometimes you'll see that muscle come out. How about over here, a little pinching or not really?
No, nothing.
Very good. Thank you for watching. Thank you for sharing. See all the fatty tissue we removed?
We'll get it all out of there.
Jill does not want it anymore.
No.
And you don't need it, so we will take care of it. So we're just removing some of the fatty tissue and a little bit of cautery, the blood vessels. Perfect. So I grab the fatty tissue and we're just trimming away here. Little swath of fat here, little swath of fat there, and then before you know it, we'll be doing the platysmoplasty where I tighten those muscles. It's important to really define that jawline, so I'm looking for the fatty tissue here because that's the area where you'll get your most definition is by bringing it all the way up to create that neckline of a 30-year-old. That's our goal, huh? Thank you for watching. Thank you for sharing. Hello, Sandra. Hello, Miriam. Hello, Maxine. Thank you for watching. Perfect. Everything's looking good. So little by little, step by step, we just trim what we need to trim. And Jill will be done before she knows it. Yesenia has everything set up perfectly, makes it very easy. Hello, Nun. Hello, Ruth. Thank you, thank you, thank you. Muchas gracias. Perfect. So I use the gauze, that helps me to visualize. Muchas gracias, Ruth. Okay. I use the bipolar cautery. That allows me to cauterize the little blood vessels. And can you show me here in the middle, please?
Mhm.
How is Jill feeling?
I'm feeling great.
Good. If Jill's doing good, then I'm doing good.
Feels
A little pinch there.
No.
So this is called the platysmoplasty. I'm just trimming some of the fatty tissue here. Perfect. Everything's looking good. Hello, Graciela. Hello, Tammy. Thank you for watching. And I turn your head just a little bit this way. There we go. And chin all the way up. That's perfect. Hello, Hunter. Hello, Josephina. Thank you for watching. Thank you for sharing. As I use the bipolar cautery, I'll use the gauze to just clear off the edges here. Perfect. So now again, trimming some of this fatty tissue to outline the jawline. Thank you for watching. Thank you for sharing. We are in Tampa and the Villages, Florida. We have our Villages seminar tomorrow. You can download our book on Kindle. We guarantee we can make you look younger. We hit the Wall Street Journal bestseller list. Very proud of our patients that are featured there. And come out to our seminar, you can hear from some of our own patients. I'm going to turn your chin all the way up. That's perfect. Thank you. Hello, thanks for watching, thanks for sharing. If you're just joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're on a mission to stop bad plastic surgery. We're here to show you how to do things the right way. Perfect. Okay. So now I'm going to do a little bit of stitching here. Jill, you're going to feel it get a little tighter.
Okay.
So this is the 20. Can we get some gauze for me, please? And that second Decibond, thank you.
Mira, lo tengo.
So I grab the edges of the platysmal muscle. And I bring them together.
Thank you, Shirley. You're amazing.
And you drop that suture as well.
Okay.
Perfect. We will be rebroadcasting later, so make sure you are following so you get our alerts. I'm going to do a little trimming of the fatty tissue here. Hello, Ithaya. Hello, Dana Dane. Thanks for watching. Thank you for sharing. We're doing a local anesthesia facelift. Trim just a little bit more skin here. I like to fuss over the little details. Perfect. Hello, Dara. Thanks for watching. We're doing the platysmoplasty now on the Awake local facelift. Jill, do you feel that getting tighter?
Yeah, a little bit.
Perfect. Everything's looking good. Hello, Anita. You feel any pinching there or not really?
No, nothing.
Thank goodness for lidocaine.
Mm-hmm.
Perfect. So that is the platysmoplasty. Looking really, really good.
Good.
So for my physicians and students that are watching, once I do the platysmoplasty, that's going to give me more visualization. So if you're doing a lift and you feel you can't get good visualization, once you complete the platysmoplasty, you will definitely have better visualization of the submental area. Let me turn your chin all the way up. There we go. Hello, Betty. Thanks for watching. Thank you for sharing. Okay, perfect. Little pinch there.
Mm-mm.
Perfect. Okay. So what I'm going to do now, I'm just going to change over my gloves.
Mm-hmm. Got an itchy ear.
And
My ear itch.
I got it.
Miss Cynthia will
I got
get
it,
that
I'll
for
get it.
you.
What?
Yep, I'll get your ear.
Wasn't here.
Yep, I'll get it.
It's like made my ear itch. Okay.
Yeah, just let
Like
me know and I
tickle.
got you.
Okay. It was like tickling.
Yeah.
Gotta wind up.
You look gorgeous.
No good.
For the physicians and students that are watching, you can change your gloves for different parts of the case. I just
I
like to
felt
make
like
sure
there
I
was
freshen
all
up my
kinds
gloves.
of things on my neck, like instruments.
No. Oh, yeah, in your neck?
I'm
Yeah,
also
that's what it
making a
felt
little
like.
adjustment on the headlight.
That
So
didn't
you can
hurt.
Lower that here.
Yeah, you're gonna feel a little bit of pulling, or tugging.
Oh, I heard,
pressure,
I felt tugging, but it didn't hurt. Didn't hurt at all.
If you're just now tuning in, this is Dr. Rich Castellano. We're doing a local anesthesia facelift. Jill is doing great. How are you feeling, Jill? You doing okay?
Wonderful.
And Yesenia has everything set up perfectly, makes it very easy for me. We're in Tampa and the Villages, Florida. We're on YouTube Live, Facebook Live, Instagram, all of the above. Look us up at imagelift.com.
Got one bit
Chin
of
all the
pain.
way up for me. There you go. I'm going to put a little stitch in there. Feel a little pinching there, not really?
Nope.
Perfect.
Then I felt a
Little
little bit.
pinch there.
A little
Yeah.
bit.
So I'm going to do a little bit of numbing medicine. Thank goodness for lidocaine. So if Jill feels a pinch, then I do a little numbing. Do you feel any pinching there?
Mm-mm. No.
And then she's going to feel nothing.
This is the first time.
Perfect. Release fully. Very good. Release totally, please. So I like what I see in the contour of the jawline there.
Good.
I'm going to work over here. Exposure on the side, please.
What?
Everything's looking good.
Good.
Lucy says she's brave. She's a strong woman. That's what Lucy said.
I don't feel a thing.
But you don't have to be brave. I'm going to turn your chin up. That's perfect. Just like that. Thank you. Thank goodness for lidocaine. Perfect. I'm going to trim a little bit of the fatty tissue. Do you guys have all the phone numbers for me,
Yes,
please,
we
Ari?
do.
Trimming a little bit of the fatty tissue. And defining that jawline. Gentle, gentle, you can use. There you go. Nice. Perfect. Very good. Can you turn your head this way a little bit? Release totally, please. Love that neckline. We're not stopping until we get the 30-year-old neckline.
Good.
That's what we're here for. Okay, I'm going to turn your head all the way this way now. Hello, Zenaida. Hello, Patricia. Someone said they had a liver transplant. It's hard for them to watch this, but you don't. This is much easier than a liver transplant. Can you recycle BP for me, please? So now, this is the hair-sparing incision. Preauricular. She'll feel pressure, but Jill doesn't feel any pain. Do you feel any pinching here?
No.
Everything's looking good. Hello, Cindy. Thank you for watching and thank you for sharing. We guarantee you have family members or friends that are interested in these types of treatments. So before they do the wrong thing or choose the wrong doctor, make sure they've seen our videos. How about here? Any pinching at all?
No.
Nothing. Stay forward, please. We will be rebroadcasting later, so make sure you are following. Make sure you like us on Facebook and follow. You can get your updates, and we have specials and promotions. And come out to our seminar, imagelift.com/events. We've got our Waterfront Inn seminar tomorrow. We're at Brownwood later. A few more weeks, and then Sun City. All around Central Florida. Perfect. So as you can see, there's really very little significant bleeding. And I'm just elevating the skin here. Subcutaneous plane. And I use my bipolar cautery. Hello, Charo. Hello, Yvette. Little pinch there. Perfect. Is this a lower lift? Release, please. So when you talk about facelift, upper, lower, full, so we are including the neck and the jawline. Some people call that lower facelift. You don't need brow lifting or the cut across the top of the head. And we're going to do the upper eyelids too. So yes, it is a lower, it's a type of a lower lift. There's different ways to determine different facelifts, right? Number one is the anesthesia. This is obviously a local anesthesia facelift as opposed to general anesthesia or twilight. Some people will talk about twilight as if it's safer, but twilight is still just as dangerous as general anesthesia because you need an anesthesiologist and you need to have an IV and you have more of the anesthetic. So can you grab a gauze and put that on 27, please, on bipolar? Bipolar 27. Thank you. Everything's looking good. So little cautery to seal the blood vessels. And I have the Pons and Browns. So now with the Pons facelift scissors, just lifting and elevating. Thank you for watching. Thank you for sharing. We will be rebroadcasting later. So make sure you're following. Or visit us at imagelift.com. Perfect. Everything's looking good. So here I'm going to do another application of the SMAS where we did that in the platysma before. Now we're doing it in the preauricular SMAS. There are some doctors out there, they remove glands from the neck and they remove muscles in the neck, which I don't think it's a good idea to remove muscle or glands from the neck. I just think it's too much. Little pinch there. Yeah. I'm always watching the patient. If they move a little millimeter, I'm like, are you okay?
I'm fine.
So she just adjusted a little bit. So she says she's not feeling anything. And of course I believe Jill. The best monitoring of any patient is to talk to them. How are you feeling? They'll tell you. They say, I feel fine. Or they say, this, I'm sore. Then you just address it right away. Then I say, do you feel anything after the numbing? Nope, I don't feel it. Okay, great. You keep going. Way better than having an anesthesiologist for something like this. You don't need it. Closure, please. So again, the 2-0 nursing. Cirugía me la hizo detrás de orejas. Don't know what that means.
Behind the ear.
Beginning of the year?
Her surgeon.
Me la hizo detrás de
In the back
orejas.
of the ear.
What's that?
Her surgeon did it, the incision in the back of the ear.
In the back of the ear? So we go in front and behind the ear, but it's difficult to see those incision locations. Everything's looking good. Perfect. You're going to feel that get tighter here, okay, Jill?
Mm-hmm.
So we flash the suture, that way I can tie it under tension. but tightest that way. Tightening things down. Where is the arruga otra vez? We're located in Tampa, in the Villages, Florida. Puedo otra vez. Where is the other vez? Other location? Tampa and the Villages.
Oh, por favor, pregúntale el doctor. ¿Puedo otra vez? ¿Puedo otra vez de qué? Root.
Behind the ear, please. Everything's looking good. Hello, Josephine. Thank you for watching and thank you for sharing. So this is a SMAS plication as opposed to a SMAS imbrication. This is not a traditional facelift. Go ahead. So in the preauricular, then I'll use some. In the front things, I'll use the 2O Vicryl, polygalactic acid,
O hacerte la cara.
what's that?
Si tú quieres ir a www.imageless.com de los precios, ellos te lo pueden dar. Porque cada una de las cirugías es diferente de otra.
Perfect. See, in Tampa.
What's the telephone number?
What was that telephone number? 813-463-9245. Release, please. See all the extra skin, we're going to trim that away. Very good. Sometimes a half inch or a full inch. Right, I mean, that's quite a bit of skin that we take out and remove. Just enough, but not too much. Trimming the extra skin back here. Jill is going to love her neckline and jawline. Super excited for her. But we can't be held responsible for any behavior she gets involved in when she looks younger. Release, please. But Jill always behaves. She's always behaving. Ragnall and Alfred, please. So we don't have to worry about that. Hello,
Everybody
Abir.
should have it done.
And thank you, Abir, for your very gracious gift. That was so thoughtful of you, Abir. We hope to see you soon, Abir.
Hey, dear.
Everything's looking good. hello. Thank you for watching. Thank you for sharing. Can you hit the button for me, please? Yes, we did some tightening of the platysma muscle, Brianna. Thank you for watching. Thank you for sharing. Do me a favor and just tap that little X here to get rid of that alert. Just this one right here. Yeah. Behind the ear, please. Thank you, Ruth. Thank you, April. Feel a little pinch there?
No?
Everything's looking good. And Yesenia and Charlene have everything set up perfectly. Very good. Behind the earphone, please. How about there any pinches? Hi, Brianna. Give us a call, 813-463-9245, or you can message imagelift.com at the website, and we can set up your consultation. Now I'm going to do release, please. Eight 463-9245. All the way down, yeah. Good. Hello, Karen. Hello, Melva. Thank you for watching. Thank you for sharing. We're going to have more videos, so make sure you are following. Hello, Tasha. Hello, Arinda. Hello, Jacqueline. Local. So now I'm going to just trim a little bit of the skin so that it fits the contour of the earlobe. Perfect. Local, please. I'm going to take these and do a little bit of the numbing medicine so you feel a pinch. 1, 2, 3, pinch. Little pinch, and then I'm going to numb all the way across through here. Hello, Cherry. Thanks for watching. Thanks for sharing. We guarantee you got family or friends that are interested in having this done. Let me turn your head this way just a little bit. So we're on a mission to stop bad plastic surgery and teach people how to do things the right way. Perfect. You feel small, medium, big, little burning there. That's going to go away. That's some of the numbing medicine. Pinch on 3. 1, 2, 3, pinch. Sorry, pinching. Tap, please. Little pressure, a little pinch. Sorry, a little burning, a little bit of the numbing medicine. Walk, please. Chromic, please. Can you turn your head all the way this way?
Eye.
Sorry, a little bit in your eye. Can you use chromic, please?
Yes,
Can you turn your head this way, nice and easy? So now we're just stitching up around the ear. Hello, Caroline. Hello, Rose. So one continuous stitch all the way around the ear. Hold real still now. Definitely do not move at all. So this is the tragus that we're stitching. It's important to recreate the tragus so that way it hides the look that you had a facelift. Some facelifts, they'll take the tragus away. I've recreated the tragus, little pinching there,
A little bit.
little pinch.
Alright. I'm good.
How about here? Do you feel a little pinch?
Not right now.
So you can recreate the tragus in some cases if it's been removed, but you don't want to remove it with the facelift. These are the little details you got to pay attention to. Hello Florence, hello Marie, hello Caroline. I put a few extra stitches around the lobule. The tragus is that little bump in front of the ear canal. Latin for the billy goat's chin. Like a little billy goat, Latin tragus. How are we feeling? You doing okay?
Good.
Your eyes are going to feel goofy with the numbing medicine.
Yeah, they do already.
Perfect. Hello Florence, hello Mary, hello Maria. Patients are doing more procedures now than ever before because they've got time. They're home. They're not traveling. They're wearing masks, so it's a good time. Make sure you got to follow the sequence. Okay, a little bit of the numbing medicine. I'm going to turn your head all the way to the middle. So for the upper eyes, hello, thanks for watching. So, do you feel any pinching here? Not really?
Nope.
15, please.
Well, I feel like my ear's clogged up.
Your ear may feel a little clogged, and that's going to reset for you.
Seems like that eye is worse than the other one.
Always one side's a little bit different than the other.
Yeah.
Feel a little bit of numbing medicine.
Like my
feel-
eyeball.
Yeah, it feels burning. So
Yeah.
that's just the numbing medicine that seeps out. You're going to feel that ease up in just a moment.
Okay. Okay.
Feel that easing up?
Uh-huh.
Can you put that on 22, please?
Yes, sir.
It's fine now.
Everything's looking good.
Good.
Thank you for watching. Thank you for sharing. Hi, Sharon.
Sounds like all my girlfriend calls.
Ha ha ha. Did you tell them you're having it done?
Yep, April, my daughter.
You're having a watch party.
Mm-hmm. That will be here next month for it.
Perfect. So stitching away. Everything's looking good, so make sure you're following because we will be rebroadcasting in a little bit. We're going to do the other side.
Yeah.
Jill wanted both sides done, so
Oh,
we're
yeah.
going to do both sides.
Oh, yeah.
And the chin, under the chin is amazing, so it won't take that much longer. Do some
Good.
tightening on that other side, trim the eyelid skin. And Jill's homework for tonight is keep her head elevated, drink plenty of fluids, and then the pain pill every couple of hours, every 2 to 3 hours, check to see if you need a pain pill. If we sleep for 6 or 8 hours in a row, we don't want to get behind with the pain medicine, so we prefer to stay ahead. And we're going to review that again. And then I'll call later tonight to check in.
I have one of those beds that go up.
Good, she's got the bed that goes up.
Mm-hmm. My husband hates it up. He'll have to go in the other room.
Very good. Very happy with what I see. Thank you for watching. Thank you for sharing. I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. I'm doing eyelids, facelift under local anesthesia. Hello, Deborah McClintock. Good to see you.
Oh, she's there?
Yep,
She's
you go,
watching.
Jill.
Cheering you on. Jill is so happy you're watching, Jill and Deborah, and so are we. It is amazing with technology today what we can do, that we can just include people here. It's like they're in the room.
Oh, she's picking me up, so.
Well, so she's going to know when you're done.
Mm-hmm.
Okay, we will be rebroadcasting. We're going to start on the other side. Hi, Ruth. Thanks for watching. And you see her neck and jawline here, how smooth that is. We're going to do some stitches there. But if you take a look here, you can see that's the after. Here's the before. And what a nice difference. Can you hit the button for me, please? What a nice difference in the neckline and jawline there. So proud. So congratulations, and we'll see you all in the next video. Bye. Great job. Can we?